Thank you for joining us for another program of Budget in Focus. Dr. Ashley Singh, Senior Minister in the Office of the President with responsibility for finance, unveiled that $383.1 billion budget that was presented to the National Assembly. My understanding is that the intention of the budget, there's a specific intention for the healthcare sector to transform it to something that can be compared to the rest of the developed world. I'm your host for this program, Travis Bruce, and today I'm joined by the Honorable Minister of Health, Dr. Frank Anthony. Thank you for joining us, Minister.
Well, thank you very much for having me on your program.
Great. You know, Minister, as we were talking, I remembered from President Ali's speech to the 12th Parliament, he made it very clear that safeguarding the healthcare for everyone across the country is government's most important priority. So how do you see yourself or your role as the Minister of Health really paving the way or making this projection a reality?
Well, as you know, we came into government in the midst of a pandemic, and our first priority was trying to make sure that less people got sick, and that even if they got sick, that they can be taken care of. And so as soon as we assumed office, this became our priority, and we worked very hard to make sure that we were able to stabilize the situation. Now that we have done that, we are now working to ensure that we can get vaccines into Guyana so that we can immunize the population and therefore achieve herd immunity and protect our population. So what President Ali said, we are now working to put that into reality.
Yeah, definitely you are. And you know, when we think about this year's budget, holistically, it is the largest budget that we've ever seen in this country, but it is proactive, it is pro-development. And specifically, the Ministry of Health is receiving a $53.5 billion to help in programs and agendas. What were your thoughts when you heard of this figure that you will be receiving through the ministry to accelerate the programs?
Well, we have received a very generous portion of the budget, and as you can see from the items that we have to spend it on, it's really things that are very critical to the health of people. We have allocations there, of course, for COVID, which is a priority for the government. In the capital budget, we're going to be spending $1.7 billion alone on COVID. And in the current expenditure, there's even more monies there for COVID. But there are other programs because the ministry, we looked at a number of infectious diseases such as malaria, TB, HIV, leishmaniasis, filaria, and a whole host of others. And we have made adequate provision in those areas to ensure that we can take care of people with those diseases. And while we have a focus on eliminating some of those infectious diseases, we're also at the same time working to prevent chronic non-communicable diseases in Guyana. And for the first time this year, in this budget, there's a new program that has been created to deal with chronic non-communicable diseases. So I think that's a step in the right direction, and it shows that the government is placing a lot of emphasis on these chronic non-communicable diseases, where it ought to be, because we're seeing that among the top 10 diseases right now, chronic non-communicable diseases would be probably about 6 of them. So we have to focus our attention there and to reduce the burden of those diseases.
Yeah, and you know, one of the highlights of that budget presentation by Dr. Ashley Singh was the Health Ministry receiving an allocation, of $99.8 million towards the re-equipping of the National Ophthalmology Hospital there in Port Moran. But is there any plans to expand its services across the country so everyone would be able to benefit?
Well, the thing is with the ophthalmology hospital at Port Moran, I would say it was, we had a lot of hopes for that hospital. Unfortunately, in 2015, the place was neglected. And so when we came into office and I went to visit, many of the equipment that was at Port Morant was not working. The theater, for you to do eye surgery, you need special microscopes and so forth. And they were not working, or those that were not working properly. And although we have specialist doctors there to do different types of eye surgery, they could not work because they did not have the equipment. We have a team of Cuban doctors that are there, and of course we have local Guyanese doctors, but they weren't able to do anything. So we had specialists literally sat down there for 5 years, unable to work because they didn't have the equipment to do anything. And so one of our priorities that we set was to make sure that we got the equipment to restart the services at the hospital. And that's why you see that sum of money that was placed there, because we were hoping to refurbish and to buy new equipment to make sure that the theaters are working. While we are doing that, we have also looked at assigning some new responsibilities. So we have asked Dr. Shailendra Sugrim to be the National Eye Disease Coordinator in Guyana, and he has graciously accepted. As you know, he is the head of the department at Georgetown Public Hospital, where they do a lot of eye surgery. So I think he is very capable and fit to be the national coordinator, and he has since been overseeing the work that we are doing right now at Port Morant Hospital to restore it back to that former glory, if you like. Just last week, Dr. Sugrim and a team went up to Port Morant, and they were able to start the first 15 surgeries, very successful cataract surgeries, and we hope to continue that. So imagine for quite a while, no surgeries were done. So we've now been able to restart that, and we're hoping to keep pace and to make sure that we can bring that hospital fully into utilization. So the budget allocation there is going to help us to buy the equipment to make sure that we can restore services at that hospital.
Okay, you know, starting off with a bang too, in just a week's time, being able to achieve so much. And you know, we're presently in a pandemic, without a doubt. We're wearing our face masks, we're keeping our distance. And every sense of our livelihoods, it's changed, and it remains a great concern. So with $2.1 billion going specifically towards the acquisition of critical medical items, including but not limited to medical supplies and COVID-19 tests, would you say these are contributors for us really achieving herd immunity, or something that can help us in a way to achieve that herd immunity?
Well, some of that money is going to go to buy personal protection equipment. These are things like face masks, the N95 surgical procedural mask. We're also going to buy gongs because the health staff would change these quite regularly. We have to buy caps for the person's head to cover their hair. We have to buy shoe covers. So all these things are important, and they're disposable. So they wear them one day and then they discard them. And it's costing quite a lot of money to be able to constantly supply these things. We also have been distributing face shields so that people can use them and protect their face, along with the mask, of course. So personal protection equipment has really taken up a sizable chunk of the resources that we need. But we are spending this money because we want to ensure that our frontline healthcare workers are safe. And so that has been the reason why we keep buying and spending, to ensure that our workers are safe. In addition to that, we have to buy medicines. The population would come to our public health facilities to ensure, we have to ensure that they're getting all the medication that they need. You would recall not so long ago we had some severe shortages. We're still trying to correct that. We haven't been able to remedy all of it, but we've made some emergency purchases, and it's much better than what it was a couple months ago. Because we really inherited something where a lot of the essential medicines were short. You didn't have medicines for diabetes or hypertension or all the basic things that people need. Painkillers were not available. And so we had to spend literally billions of dollars trying to secure these things. And in the midst of a shortage, when we checked the bond, the materials management unit, the big bond that they have there, they had close to 1 billion Guyana dollars of expired drugs that were there, which we had to throw away. So imagine just dumping $1 billion of medicine. So you had shortages, things were stored there, people were not able to get it, and it remained there until it expired, but people needed it and they weren't getting it. So you had these types of problems. So we are now trying to rectify a lot of these problems that we found, and we are trying to push more of the medicines that we have into regional bonds and then get them out to the health centers in the different regions. So we are still not satisfied with where we are, but we are working to regularize and normalize the situation that we have. Probably take us a couple more months, but we are getting there slowly.
Yeah. And you know, still on that note of COVID-19, we see for the gene expert machines, an additional $17.6 million will be pumped in to get some of those to disperse them across the country. But how will we be able to benefit? But first, tell us exactly what gene expert machines really are.
But these are, in a simple way, it's basically a piece of laboratory equipment that can do PCR testing.
Okay.
Now, PCR testing is not only used for COVID. I guess we have popularized it with COVID, but for other diseases, we can do PCR testing as well. But you need specialized primers and probes and so forth to do that. So in the case of these gene expert machine, we can do what is called point of care testing, meaning that if you come and you set up one here, we can actually run the tests here. You don't need additional equipment to do the tests. There's a special cartridge that is used. And so in this case, we're going to use the COVID-19 cartridges, and we are able to run like 4 tests every time you run the machine. So, and it's quick. You know, it takes about 30 to 60 minutes or something like that to be able to complete this test. So if you see someone and you suspect them to have, say, COVID-19, you're able to take the sample, run the test. Within an hour, they're getting back their results. So you can actually tell them their status and then decide how you continue to treat that person. So we have been able to buy these machines. We have deployed one in Latam because one of the challenges has been when you take a swab and you take that sample, you have to wait until a plane goes in to send that out to Georgetown to be able to run the PCR in Georgetown. Now, with the machine being there, they would have a turnaround time of an hour, so it makes a big difference in terms of patient care.
Yeah.
When we first came into office, it was taking sometimes 7 to 8 days for you to get a turnaround time on a PCR test. And we have changed that drastically now. You're literally taking an hour to be able to do that. So that's the difference, you know, that we've made over time. And these machines are playing an integral part in reducing that time. Apart from Latam, we have one right now in Mabaruma as well. We have one in Linden, we have one in New Amsterdam, and those that are budgeted, we will be able to place them in Region 8 and Region 7 so that we can reduce the waiting time for people who want these tests.
Okay, thanks. And we know COVID-19, yes, we're in this pandemic. It's like the most major health concern right now, but attention also needs to be placed in other areas. So let's talk a little bit about non-communicable diseases. I know there's a plan to scale up the response. Can you tell us a little bit about that?
Yeah, well, as I said, one of the first indication that you can see non-communicable diseases being a priority of the ministry is that we have separated it out as a program.
Yeah.
So the ministry previously had 7 programs. We now have 8, which is chronic non-communicable diseases. Under that rubric, we are looking at things like cardiovascular diseases. And this year, we are going to be partnering with PAHO WHO to introduce a special program called HEARTS. and this is intended to help to reduce the risk of getting heart diseases. So some of the things that we will be looking at include how do you control people with hypertension? What are the things that we can do, the lifestyle changes that we can make for someone who has been hypertensive to reduce hypertension in that person? And also, how do we prevent hypertension from occurring? So that would be the focus of this program, along with a number of other things that we'll be doing for cardiovascular diseases. We'll be starting it, we'll be training physicians and nurses to be able to implement this program, but then this program is going to be a long-lasting program because in other countries where they've implemented it, they've seen a significant reduction in terms of hypertension and other cardiovascular diseases. We are also looking at diabetes. And as you probably would know, it's estimated that about 60,000 people in Guyana suffer from diabetes. And that's quite a lot of people. And if you don't control diabetes, the persons who has this disease can end up with things like problems with their leg. They can have ulcers and so forth. They can have kidney problems. They can have problems with their eye. And eventually, if it's not managed properly, some persons can get blind. So we want to do something new, and that is we're going to pilot a program where you can come to what is called a diabetic center, and at that center, all the services that you need for diabetes would be available. So you come in, you'll be able to see the doctor. If you need nutritional advice, you'll have somebody to offer you that nutritional advice. If you need to test your eyes to check to see whether or not you have a problem with your retina, that test would be available right on the site. If you need to look at your feet to check to see whether or not you have any sores or you need to have special shoes, we'll be able to provide that. So we are going to pilot this concept. It has been done in other countries. Our neighboring country of Brazil, they have such a center. In Haiti, they have a center like that. So we want to start that here in Guyana. And if it works well, we are going to roll this out into other regions. But we have this seed money in this budget to be able to start the first one in Guyana.
Okay, that sounds great. And HIV also continues to be a problem, not only here, but worldwide. And 900 million has been set aside for programs specifically to curb the spread. Can you tell us about these ambitions or these programs that would be rolled out?
Well, we have the resources. As you know, patients in Guyana with HIV would be receiving their ARVs. And we have been working with UNAIDS to try to achieve the 90-90-90, meaning that 90% of the persons who are on treatment, who have been tested, must be on treatment, and 90% of those must be virally suppressed. So we have been working on these targets. We are a little bit off, but we hope that with the new resources that we are getting, that we'll be able to get more people receiving treatment and get more people to be virally suppressed. And when we say virally suppressed, once you use your medication, and if you do the blood test, you wouldn't find the virus. So those persons who are virally suppressed cannot transmit HIV to another person. And that's what we are aiming to achieve in Guyana. Now, in addition to that, we want to work on the preventative side as well. And to do that, we are going to be doing what is called comprehensive PrEP programs. So it's not only for persons who are serodiscordant couples, but we want to ensure that anyone who feel that they're at risk for HIV and they want to come and have pre-exposure prophylaxis, that we are able to offer that. And so we would be expanding PrEP in Guyana, and that's one of the things that we have committed to. And we'll be rolling that out over the next 4 to 5 years. In addition to that, one of the global recommendations has been for persons to be able to do self-testing. And so we are working on a strategy to include self-testing. So you can buy a kit and then you go and you can check yourself at home and so forth. But of course, there are some other safety parameters that we have to put in place because, you know, somebody checking the thing and
Not reporting.
no, not only reporting, it's good for them to know,
Yeah,
but they must also understand how to cope with the results.
yeah.
And therefore, they might need some counseling and so forth, and those services must be available. So we have crafted a strategy, and in the next couple of weeks, we are going to release those strategies of how to roll out self-testing for HIV. So there are some new things that are coming, and we want to roll it out because we have seen these things work in other countries that have started rolling them out in those countries.
Yeah. And you know, Minister, we also have to think mental health. The health
Hmm.
ministry is not only about physical health, but
Of
mental
course.
too.
Yeah.
So a construction of that mental health ward will be streamlined. How
Mm.
important do you think that plan is for the ministry at this time?
Well, it's an issue of capacity, you know, because we need more space, and our patients have been getting a challenge in terms of when they need to be in hospital to be properly accommodated, and that's where we're going to be spending that money. But there's a lot more that we'll be doing in mental health.
Mm.
So one of it, we're looking at developing a mental health law, and we have a draft bill that we want to bring to the Parliament soon. But before we do that, we of course would consult widely, and so that's in preparation. In addition to that, we are also looking at a new mental health strategy for the next 5 years, and as a subset of that strategy, we'll be also looking at a suicide prevention plan. So a lot of background work has started where we're working with experts in these fields to help us to put the documents together. And we have persons in the ministry who have been designated to work in these areas. One of the things that we want to pay a lot of attention to has been this whole issue of drug abuse. You know, people, we have seen the effects of that, people becoming addicted to these substances, and then they have a major problem in terms of coming off of those substances. So a lot of the substance abuse problems have been provided by NGOs, and we want to support them to be able to increase the services that they're providing. But we also probably would need to start providing some of those services in our institution. So as part of the overall mental health plan, these are some of the directions in which we are going.
Yeah. Minister, as we're coming down to program time, I want us to touch a little bit about family planning, but specifically sexual and reproductive health and rights. I know a policy will be streamlined, it will be on board soon. How effective do you think this will be? Because I know it's supposed to be guiding the healthcare sector.
Yeah, of course, that's another one of the areas that we are working on to develop a new policy that encompasses all the areas of sexuality and sexual reproductive health. We know that we have been providing these services, but in some cases there have been gaps, and we want to ensure that we have a comprehensive program where all those gaps can be filled. So we will be looking at female reproductive services, male reproductive services, and make sure that everybody is properly covered. So it's it's going to be a very hectic year.
Yeah.
And as you can see, we're not only looking at COVID.
Yeah.
While COVID remains a priority until we are able to immunize everyone, we would still have to work on the other areas because these diseases are not going anywhere.
Exactly.
We still have to make sure that we can provide that type of care.
Yeah, and on that note, Minister, you know, as we're wrapping up today, we really need to have persons understand that COVID-19 is here. And the only way we can advance healthcare in Guyana and push the agenda of these other things and resolve issues, I know we have the File Area campaign that is ongoing right now, but people need to understand that it is serious. It is
Mhm.
important to wear that face mask and wash your hands. So is there an appeal that you perhaps would like to leave with our viewers and our listeners at this time on why they should indeed take COVID-19 very seriously?
Well, I think that message has been out there
Yeah.
because we have been talking about it constantly to get people to understand the seriousness of it. But once people start, um, taking the precautions, you can see that the amount of cases would drop. And so we know that face mask works, and we have seen those persons who have been wearing their face masks would be protected. They don't get sick. And if they wear it consistently over their nose and their mouth, they don't get sick. So it works. And we want everyone to follow these rules. In addition to that, we are introducing vaccines. We have started with the first 3,000 doses, and the uptake has been great. A lot of the doctors and nurses have been coming to receive their vaccines. And later in the month, by month end, we'll be getting some more vaccines, so we'll have more available. And our first thing is to ensure that we can protect our health workers so they would get first priority, but we'll have enough to be able to start looking at other risk groups, including older persons and persons with comorbidities. And we are very hopeful that through the media and so forth, that we can get more people to understand the importance of coming out and getting their vaccine. Because if they are immunized, it protects them from getting the serious form of COVID. In a lot of cases, it might prevent them from getting into the hospital, or if they are in the hospital, to prevent them from getting into the ICU. With the AstraZeneca vaccine, all the studies have shown that after the 22nd day, 22 days after the first dose, that the persons who receive that first dose don't, it protects them from getting the most severe form of the disease, of COVID-19. And therefore, they're not going into the hospital, they're not going into the ICU because they're protected. And on the arm that where the persons did not receive the vaccine, a lot, a lot of persons got ill and ended up in the hospital. So this thing really works, and therefore we are urging everyone, when the vaccine become available to you, please come out and take it,
Yeah.
because it can literally save your life.
Thank you for those final comments, Minister. It is important for everyone out there listening and viewing this program to wear that face mask, and so that the Ministry of Health can advance its agenda and ensure that we are safe and that all people have access and equal access to healthcare across this country. So thank you once again, Minister, for being with us on this program, and thank you for joining Budget in Focus once again.